Hi, this is Dr. Handwara. I'm one of the psychiatry faculty with the residency program. And today I have Dr. Alex Manjarian with me, who is a PGY for med psych resident. So today we decided to talk about neurobiology of depression, and there is not much on YouTube or anywhere which explains the neurobiology of depression. We all prescribe medication, we all treat depression, but we don't know too much about what goes on in the brain when it comes to depression or any psychiatric illness. I know that people can actually be a psychiatrist without knowing the neurobiology of depression, but understanding it actually gives you a better idea of what you're treating, and plus, it also gives you an opportunity to talk to your patients about what is going on in the brain. So, we are going to do this actually in piecemeal. So we are going to first talk about few areas of the brain that plays an important role in neurobiology of depression. So the first area of the brain that we are going to talk about is the orbitofrontal cortex. And I want the viewers to remember that the research world is very dynamic, it's not static. So anything that I talk about today may change actually tomorrow as we learn more and more about the brain with better technologies, right? So whatever I'm going to talk about is pretty recent, and a lot of this information is from an article that is published by Dr. Edmund Rolls, who I think is great. And today we are going to start with neurobiology of depression, right? But before we talk about the neural circuitry of depression, we want to talk about different areas of the brain that is involved in depression. And today's topic will be orbitofrontal cortex. And the pictures that you're going to see is from an article published by Dr. Edmund Rolls. It's called Emotion, Motivation, Reasoning, and How Their Brain System Are Related, published in Brain Science in 2025. So let's begin. So let's talk about where exactly orbitofrontal cortex is located, right? As the name suggests, it's just above the orbit in the frontal lobe. So it's usually at the base of the brain, always at the base of the brain, right? So that's orbitofrontal cortex. So if you look at the MRI scan at the top, so if you look at the row A and you look at the finger, it's pointing towards orbitofrontal cortex, which is in red. So this is the sagittal section. This is the anterior part of the brain. This is the posterior part of the brain, all right? And at the base of the brain is your orbitofrontal cortex. This is the coronal section. You see the orbit, and the red marking right above it is the orbitofrontal cortex. And this is the axial section. So you're looking at the base of the brain. So this is the midbrain that you're seeing, the Mickey Mouse. And as you move anteriorly or ventral, you see the red area, which is the orbitofrontal cortex, right? And the same thing at the bottom, which is in blue. Now, what is the role of this orbitofrontal cortex, right? And at the bottom of this particular brain scan, you see another cartoon actually, which talks about how sensory informations reach the orbitofrontal cortex, right? We're not going to talk about amygdala in this particular talk, as we are going to just focus on the orbitofrontal cortex and how does it process sensory information, and what is the relevance, like what role does the orbitofrontal cortex play in depression and other psychiatric illness. So let's look at the orbitofrontal cortex itself, all right? So I'm going to write here. So if you look at the orbitofrontal cortex, it sits in the brain, base of the brain, and plays an important role in emotion. So it's a part of the limbic system, right? So most of the sensory information, we are going to talk about something called as the primary reinforcers, okay? Now, primary reinforcers are stimulus like touch, texture, taste, face, right? These are some of the primary reinforcers, right? This is required and you need to actually attach an emotional and rewarding value to these primary reinforcers, which help us to interact with our social surrounding, right? We interact with our social surrounding by recognizing a person by the face, right? Face basically depicts us the emotion, like what emotional state the person is in and how you're going to interact with the person depending upon their emotions. Then when you meet a person, you tend to socialize, right? Socialization is socially acceptable. So you go and eat. And when you eat, what do? You taste the food, right? This is how you bond with people. Then touch. A lot of our interaction involves touching, right? And as we know, and we are going to talk about it sometime in future, like soft touch usually helps release of oxytocin, right? Which plays an important role, especially in calming or in controlling the mood, right? So touch is a primary reinforcer, and then texture, like how things feel, right? So what the orbitofrontal cortex does is all this information will reach the orbitofrontal cortex, and the orbitofrontal cortex plays an important role in assigning a rewarding and an affective value to these primary reinforcers, right? Based on the rewarding value or based on the punishers or the aversive signal, we basically learn whether we are going to interact with the surrounding or we are not, right? So what the orbitofrontal cortex does is that after it assigns an affective and a rewarding value to these primary reinforcers, it tries to actually integrate these values to other stimulations or sensory inputs, okay, which could be visual, which could be auditory, or which could be actually arbitrary, right, like monetary, like money, right? Thus, what it does is that it will usually represent the expected reward value for the visual, auditory, or monetary stimulus, right? These are a few examples. You can actually keep on going with different examples. So thus, the orbitofrontal cortex plays an important role, especially in emotional regulation, right? Or we can call it that as affective learning. Right. Now, since the entire process of affective learning involves stimulus, it involves reinforcement. So it's also called as the stimulus reinforcement associated learning, right? The orbitofrontal cortex thus plays an important role. So we already know that it plays an important role in emotional regulation, right? As well as affective learning, right? Now, it also plays an important role in something called as reversal learning. Now, why is reversal learning important? This is not the only area of the brain that plays an important role in reversal learning. It's also sends information to the anterior cingulate cortex and then to the subcortical structure like basal ganglia. So all of them actually form a network that plays an important role in reversal learning, right? So reversal learning basically means that it is the change in the behavior based on change in the stimulation in the surroundings or in your environment, right? So you have to change your behavior based on what the circumstances are, right? If you cannot change your behavior according to the social circumstances, then it can lead to a very rigid cognitive style of thinking, or it can actually lead to something we call as perseveration that you see in patients with OCD. And you also see a sort of perseveration in depression, which we call as rumination, where we ruminate over negative memories or negative thoughts, negative images, right? So thus, orbitofrontal cortex plays an important role, especially in the process of rumination. So if you look at orbitofrontal cortex, so what it does is that it will, so if you know what reversal learning is, so it usually inhibits a previous relevant response. That means that a response that had a rewarding value over a period of time, it loses its rewarding value. So that has to be registered by orbitofrontal cortex so you can switch gears, right? You can move on to the next rewarding response. So that is what it does. Now, if you look at the orbitofrontal cortex, there are two parts to the orbitofrontal cortex, right? One is called as the lateral orbitofrontal cortex. As the name suggests, it's a lateral part, which is also a part of what a lot of literatures will talk about is the ventrolateral prefrontal cortex. So when you hear about ventrolateral prefrontal cortex, you need to think about the lateral orbitofrontal cortex and your inferior frontal gyrus, right? These two structures together form the lateral orbitofrontal cortex. Now, why am I talking about the lateral orbitofrontal cortex? Because this is something that gets activated when there is an aversive stimuli in the environment, right? Or there is a punishing stimuli in the environment. The lateral orbitofrontal cortex is also activated when there is loss of reward. You take away the reward, or you do not actually generate, or you do not provide someone with a reward, right? It is activated when you are actually doing a non-rewarding task. It's the same thing. For example, when somebody actually loses a loved one, that is basically like a loss of reward, right? You do not actually have another opportunity to interact with this particular person face to face or on the phone. So you have taken away the reward. Now, if you do not actually replenish the reward, then it can lead to depression. So this lateral orbitofrontal cortex is responsible for processing aversive stimuli, or especially whenever there is a loss of reward or the expected reward is not delivered or there is a non-reward, right? Whereas the medial orbitofrontal cortex, as the name suggests, is medially located. It's also a part of the ventromedial prefrontal cortex, right? In some of the literatures, they will also name this as infralimbic prefrontal cortex, right? It's the same thing. I don't know why we make things so complicated in our medical field, most likely to torture the medical students and the residents, right? So just remember medial orbitofrontal cortex, also known as a part of the ventromedial prefrontal cortex. In animals, it's called as the infralimbic prefrontal cortex. What that does is responsible for processing reward, right? So whenever there is a reward in the environment, you see the activation of the medial orbitofrontal cortex, right? So as we talked about, the lateral orbitofrontal cortex processes aversive stimuli, and the medial orbitofrontal cortex processes rewarding stimuli, right? So as you already know, right, from the talk, what happens in major depressive disorder. So patients with major depressive disorder, the fMRI study actually shows increased activation. So I'll actually use this symbol moving forward plus, which says activation. There's an increased activation of the lateral orbitofrontal cortex. And there is decreased activation of your medial orbitofrontal cortex, right? Which makes sense, right? Because depression is nothing but you're processing aversive stimuli, right? Depression, you get depressed when somebody doesn't give you a reward or the reward is taken away, right? So the lateral orbitofrontal cortex will get activated, as we already mentioned, the stimulus. And there is a decreased activation medial orbitofrontal cortex because you're not processing rewarding stimuli, right? And we'll talk more about like how the information actually gets transferred from orbitofrontal cortex to other areas of the brain. So in short, if there is a lesion in the orbitofrontal cortex, right, this could be actually seen in patients with, say, traumatic brain injury, patients who have a huge meningioma growing at the base of the brain. This can be seen in patients with frontotemporal dementia. So what do we see? So what we see is there is a lack of reversal learning, right? There's a sort of a cognitive inflexibility or rigidity, right? So lack of reversal learning, which basically leads to perseveration. Excuse me if there is a spelling mistake, because we are doing it actually on a go. What happens? So when the orbitofrontal cortex is not functioning well, you cannot decode the emotional facial expression, right? As I said, the facial stimulus is a primary reinforcer, right? You're not able to decode the affective tone of voice, right? A lot of time prosody or the tone of the voice tells us actually the emotional state of a particular person, especially like when you can't see them and you're on the phone, right? On the telephone. So it cannot decode the affective facial expression or affective tone. So what happens? Your interaction, your social interaction gets affected, right? So people can actually look as if like they are antisocial. If you cannot read the facial expression or the tone of voice, you come across as antisocial, right? Because your interaction is not appropriate, right? So what does it mean? The orbitofrontal cortex also plays an important role in empathy, right? If there is a damage to the orbitofrontal cortex, you lose empathy, right? And you see that in patients with frontotemporal dementia, right? Lack of empathy. Third, there is also mental rigidity, right? Makes sense, right? There's a decrease in the mental flexibility because there's a lack of reversal learning, right? So a lot of times what happens is that when there's an orbitofrontal cortex damage, the differential diagnosis involves you need to rule out frontotemporal dementia, FTD. You need to rule out antisocial personality disorder. You need to rule out borderline personality disorder, right? You need to rule out major depressive disorder, right? Or any other causes like meningioma, traumatic brain injury, things like that, right? Because these patients will score very high on the frontal lobe disorder questionnaire, right? So this is about orbitofrontal cortex. During our next talk, we are going to talk about anterior cingulate cortex and its function. And at the end of everything, we are going to tie all these things together and describe what exactly happens in depression. Thank you.